Now, let's go to one that most of the doctors freak about: neonatal rashes. Now, neonatal rashes are fortunately there are not too much variety of neonatal rashes. There are only a few things that one should be able to diagnose, and most of them are benign conditions. But usually, there's a lot of anxiety around when somebody sees a neonate with rashes. So let's talk about a few of them. Uh, Look at this, let's say a 5-6 days old neonate, and what you can see is that he is covered in pustules. Sometimes these babies are born with, like, when they're born, they've got these type of pustules on their torso. So you can see it's predominantly small pustule, discrete pustules, which are scattered on his abdomen, on his chest, proximal limbs, and probably face as well. Now, if you ask the relevant questions, this neonate is absolutely fine. This baby is absolutely fine. He has got no fever. He's feeding very well. Obviously, of 3-4 days, he's not on any medication for any reasons. Just being born, so no travel anywhere. No allergies at this age group. No contacts who have got any rashes or this sort of lesions at home, and there will be no recent illnesses. And if you describe this rash, you'll see that it's covering probably most of the body, mostly proximal parts, and there are some papules and mostly pustules, and it's symmetric. It's present on both sides. It's localized as well as central. It's non-coalescing, discrete rashes. Okay, and if you further magnify, if you look at the magnifier, so these are yellowish whitish materials in these pustules. And it's very important, if you look, there is no inflammation around the base of these lesions. So this is a characteristic striking feature about these rashes, is that despite that they look horrible in terms of the pustules, like somebody neonate who is covered up in pustules, everybody would freak out. But if you look under the microscope in good light, you will see that the surrounding area, that is the base of these lesions, is not inflamed. And this is what we call as benign pustular melanosis, neonatal pustular melanosis. The important key here is that the base of these lesions is never inflamed, because many people, they start thinking, oh, is it like neonatal varicella, or neonatal varicella can happen, but usually those, like, there would be some form of exposure, or the mother might not be, so she, the mom would never had chicken pox in her life, or she was not vaccinated. So those are some of the risk factors, and there must be some form of exposure, in utero or perinatal exposure. Then you would be thinking of neonatal varicella, because in that particular case, they need to be given either IV foscarnet or ganciclovir or IVIG. It's a varicella immunoglobulin basically. But neonatal pustular melanosis, pustules have got base which is non-inflamed. This is the key. You look it on the magnifier, and if there is no, you can swear on this one that this is benign neonatal pustular melanosis, and reassurance is the you should give them. It would clear in the next couple of days. It doesn't require any treatment, no creams, nothing. Then look at this child. This is another sort of I won't say too much common, but within those uncommon things, this is the common things. And cephalic, if you see, mostly cephalic rash, predominantly present on the scalp, on the forehead, face, and sometimes it might present on the proximal limbs as well. Now this one is a pustular rash. You can see these are pustules, and they have got an inflamed base. So you can see that there is redness around the bases. So obviously this cannot be benign pustular melanosis. Number one, this is mostly localized one. This is not a generalized one, and the bases are inflamed. But if you ask the relevant question, again, this baby is absolutely fine. He is not exhibiting any signs of any underlying physiological derangement. He has got no fever. He has not taken any medication, has not traveled anywhere. There's no history of allergies or exposure. There's no contacts at home, and hadn't had any reasons. They're feeding well. Absolutely all the vital parameters are normal. And if you describe this rash, so this is mostly present on the scalp. It's papulopustular in nature. It's also to some extent present on the face as well, you can see, and it has got an inflamed base. And if you further magnify, you can see some yellowish white pustular material surrounded by an inflamed base. But the child, like the baby, is absolutely fine. This is what we call as cephalic eosinophilic pustular folliculitis. why we call it eosinophilic, like if somehow the scrapings are taken from these lesions and examined under the microscope, they are full of eosinophils. So this is eosinophilic pustular folliculitis. This doesn't need to be treated. There are, like, Nelson textbook of pediatrics, the 22nd latest edition, says that like if you give them high potency steroids, which I don't recommend, like any neonate to be given high potency steroids like clobetasol or something. They respond very well to steroids, but ideally shouldn't be them. It's a self-limiting condition. The baby is fine as long as they take care of the hygiene. Sometimes it might be associated with some form of cradle cap as well. So if there is seborrheic dermatitis, they might also come up with eosinophilic pustular folliculitis. The only thing in that is they should, if anything can be used for, if there is associated cradle cap, they can use some form of shampoos for that, but other than that, no treatment is required. So again, this is a benign condition. Looks very dreadful, but is completely benign. Cephalic eosinophilic pustular folliculitis. Then the third one, which is relatively more common than the benign pustular melanosis, is again a 2 or 3 day old baby suddenly being rushed to the hospital by anxious parents that all of a sudden he has come up in a rash, in a blotchy pink rash everywhere. Okay, usually starts from the, let's say, from the face or maybe from the chest, and then in a small period of time the whole body is affected. So this type of baby is also fine, absolutely fine, vitals are fine, no history of fever, again everything is fine as far as the, if you ask the relevant questions are concerned. And you see it's mostly global, like the whole body is affected except maybe palms and soles, and it's symmetric. It is some of, if you see, the lesions are coalescing as well, like you see that the pink patches are merging into one another. So this is what we call as erythema toxicum neonatorum. There is nothing toxic about that, but this is how this the medical term is used for this condition, erythema toxicum neonatorum, ETN. So again, a very benign condition, We tell them that, okay, just wait for a few days and it should clear off. So usually this appears like maybe on day 2 to day 3, or mostly within the first like 10 to 14 days it appears, in the next couple of days it goes away. Baby is absolutely fine. But remember, if these type of rashes, they appear with more commonly than erythema toxicum, you might see that they might appear, these type of rashes, in 3rd or 4th week of life, and these babies are very fussy, spitting up milk and something, then probably you should be thinking of milk protein allergies. Again, like some of those associated with IgE variants, they can like have these type of rashes as well. But that babies would be very fussy, they're spitting up or vomiting and maybe having diarrhea. So, but erythema toxicum, it occurs during the first like two weeks, and baby is absolutely fine. Okay, so but again, the parents are very much anxious, and they usually rush to the ED department to see what's wrong with their neonates who just been born. So nothing wrong with these, and you just need to give them reassurance and maybe some material so that they can read about what this condition is, so they put their mind to peace. So